Welcome, everyone. Today we're diving into an Ayurvedic approach to handling migraine, or as described in ancient texts, Ardhavabhadaka.
I'm excited about this. It's fascinating to see how traditional knowledge aligns with modern migraine symptoms, right?
Absolutely. It's like the ancient scholars, they described this condition as a cutting and churning pain affecting one half of the head, much like our
Mhm.
migraines today.
And it's interesting that in Ayurveda, it's linked to Vata and Kapha disturbances, while specially noted by Sushruta as a Tridoshik Shira Roga, isn't it?
Exactly. So while most acharyas labeled it as Vataja or Vatakafaj, Sushruta had his own take, emphasizing the dosha involvement.
Yes. So what about the causative factors? I remember there are various dietary and lifestyle reasons mentioned.
Right. The review outlines two main groups. On one side, there's Aharaja Nidana, which includes things like excessive intake of dry, coarse food, fasting, even too much water or alcohol. And on the other side, Viharaja Nidana covers habitual and environmental factors.
Mhm. And then we have Mansika Nidana, largely psychological stress, right?
Yes, psychological stress plays a major role. Plus, even mild head injuries, like, say, getting hit during a sports game, can precipitate these headaches.
Right. It's almost as if the ancient physicians had a holistic checklist for migraines.
Exactly. They were really observant. Now, when it comes to management, the Ayurvedic approach has two primary strategies. First is preventive through Nidana Parivarjana, basically avoiding those triggers continuously.
Which seems very reasonable. Avoid what gives you trouble, right?
True, it's like not fueling a fire if you don't want it to spread.
Right. And the second strategy, is it the Aushad Chikitsa?
Precisely. That involves both Panchakarma procedures and Shamana Chikitsa. Panchakarma, for instance, entails procedures like Shirovirachana, where medicated oils are administered nasally, and even Basti Karma, which is essentially a medicated enema aimed at reducing Vata imbalance.
Yeah. Hold on. Isn't it a bit surprising to see something like enema therapy mentioned for headache treatment?
I get your hesitation, but in Ayurvedic thought, cleansing the body of the displaced doshas is crucial to relieve symptoms.
I see. That makes sense within their framework, though it does raise some eyebrows, doesn't it?
It sure does, but remember, it's all about balancing the body's internal environment. Along with these cleansing therapies, Shamana Chikitsa focuses on pacifying the doshas through herbal formulations, decoctions like Dashmula Kwatha, various Gritapana therapies, and even external applications like Shirolepa and Shiro Abhyanga.
Yes. I love how these methods tap into both internal and external treatments.
Yeah, and it's quite a holistic approach. For instance, Shirolepa involves a head mask using herbal pastes, sometimes with ingredients like Kumkumagrita, which is fascinating because it combines both medicinal and cooling properties to soothe the headache.
Mhm. And the use of Nashya therapy, using medicated oils through the nostrils, seems to directly connect with the idea of the head being the gateway to the body's energy, right?
Exactly, the idea is to target the head directly, shifting the imbalance from the top down.
Yeah. Now, what about the preventive recommendations? I believe there was a whole list of do's and don'ts.
Yes, indeed. For prevention, it's all about diet and lifestyle. The do's emphasize consuming oily substances and wholesome grains, plenty of vegetables and fruits, maintaining good sleep habits, daily exercise, and even yoga with pranayama and relaxation techniques like shavasana.
Right. And the don'ts caution against dominating factors like excessive intake of dry foods, overuse of pain medications, and even overindulgence in activities that can disturb the balance, like too much talking or coitus in certain contexts.
Exactly. They really emphasize a balanced lifestyle to mitigate triggers.
It's almost like having a personal health checklist every day.
Yeah, it's a blueprint for maintaining balance. And another interesting point is that these treatments aren't just symptomatic, they aim to prevent long-term complications, like the medication overuse headache you get from taking too many modern painkillers.
That's a smart angle, focusing on long-term well-being, not just immediate relief.
Definitely, and the study stresses that using Ayurvedic therapies can reduce not only the symptoms, but also the adverse effects on other organs that are common with prolonged use of conventional analgesics.
Yes, absolutely. There's a kind of synergy here between avoiding triggers, cleansing the system, and pacifying the imbalances.
Right on, it's a comprehensive strategy. They even mention procedures like dahana karma, which is cauterization, used only when other methods don't yield results, and it's applied very specifically with ingredients like pipali.
Yeah, I can see that it's meant as a last resort rather than a first line treatment.
Exactly, it's all about precision and timing. The review really highlights the importance of understanding the underlying doshic imbalances before administering any treatment.
Mhm. That brings me to a thought. Don't you think such tailored approaches could benefit modern treatment strategies, even if just as complementary therapies?
Absolutely. It's like adding another tool to the toolbox. While modern medicine focuses on immediate symptom relief with analgesics, Ayurveda offers a preventive, balanced method to potentially reduce the cycle of recurrent migraines.
Yep, I see that. So it sounds like integrating these insights could enhance overall patient care, especially by reducing dependency on conventional drugs.
Exactly, and that's the key takeaway. Treatment isn't just about fighting pain, it's about building a sustainable, healthy lifestyle that prevents such episodes from snowballing.
Yeah, for sure. This conversation really shows how ancient wisdom and modern challenges can intersect, offering new perspectives on treatment. Thanks for the great discussion on this holistic migraine management approach.